Today we are going to talk about the emergency hospice kit, or commonly known as an EKit. An EKit is a small supply of rapidly available medications used to treat common end-of-life symptoms. The most common symptoms at the end of life are constipation, diarrhea, nausea and vomiting, excess secretions, anxiety, agitation, difficulty sleeping, and pain. So the first medication that we use is called Senna. I don't actually have some with me today, but it's an over-the-counter drug. We use Senna S, and that is very helpful with constipation. We usually start patients out at 1 or 2 tablets a day, and then we can increase as needed. The second medication that we use often in hospice for our EKit is Imodium. Loperamide is another name for this medication. It's also over the counter. This is for diarrhea. So often patients will either have constipation or diarrhea, or a combination of both. So we have to manage both by using Senna and the Imodium. Next on our list is ondansetron, also known as Zofran. Zofran is used for nausea and vomiting. Often at the end of life, patients are not able to swallow, so this is a medication that just goes under the tongue and it dissolves rapidly under the tongue. And this will help with nausea and vomiting. I don't have hyoscyamine, but that is a medication that we use at the end of life for excess secretions. So at the very end of life, patients are no longer able to swallow, so they get secretions that build and it resonates, and with the vocal cords it's a very loud sound, and it causes a lot of distress for family members. It doesn't harm the patients, it doesn't hurt the patients, but it does make a sound, and so we use hyoscyamine to help combat that symptom. And just like the Zofran, it goes under the tongue and it just dissolves rapidly under the tongue. Next on our list is lorazepam. Lorazepam, we use liquid lorazepam, and the doses of lorazepam will be titrated by your physician, your hospice physician, and we usually start out small, 0.25 milliliters. I'll just show you, this is actually water, but your nurse will show you how to do this. Every syringe has tick marks. 0.25 is usually where we start. We can go up to 0.5 or even 1 whole milliliter, which is an entire syringe, depending on the patient's needs. And that is usually given every 2 to 4 hours. And that's for anxiety, agitation, and it also helps with shortness of breath. At the very end of life, patients often feel short of breath. So lorazepam, it's a muscle relaxer. It's what's known as a benzodiazepine, and it helps relax the muscles so that patients can breathe and sleep and get some relaxation. Next, we have haloperidol. Haloperidol is a medication that we use for anxiety, agitation, and nausea. It's got a lot of wonderful uses. So often at the end of life, patients will start, because they're not eating, they're not drinking, and toxins are building up in their blood. They'll start having hallucinations. Sometimes they'll get what we call terminal agitation. And that's when a patient who maybe is bedbound is trying to get up out of bed and saying they need to go to the bathroom. Things like this happen often at the end of life. And again, this is what we call terminal agitation. And haloperidol is very good at treating those symptoms. We usually start out at 0.25 milliliters. So just like the lorazepam, we use the tick marks on our syringe, start out at 0.25, and then just as the same as the lorazepam, the doctor can increase the dosage as needed depending on the patient's needs. and that can be given every 2 to 4 hours as well. So all these medications are oral medications. The haloperidol will go under the tongue, just like the lorazepam, or in the side of the cheek. Just as I had said previously, it's not uncommon for patients to no longer be able to swallow at the end of life. So the nice thing about these liquid medications is when they go into the mouth, they are absorbed by the mucosa in the mouth. So you don't have to worry about the patient swallowing the medication. Last on our list of our EKit medications is morphine. And it's common for family members and caregivers to feel nervous when they hear the word morphine. It is an opioid, it is a pain medication, and it can be abused. However, morphine is very valuable for hospice patients for a number of reasons. First of all, pain control. We see pain at the end of life, and we always want to treat that symptom. But we also see shortness of breath, which is a very common symptom at the end of life. And morphine is not only an opioid pain agonist, it actually will help dilate or open up blood vessels, which releases more oxygen to the lungs and allows for better breathing. There are a lot of myths associated with morphine, that it will cause someone to become comatose, that it will cause respiratory depression. But please understand that morphine, there is a very wide range of dosing when it comes to morphine. We always start out small, depending on if a patient has had exposure to other opioid medications, and then we will increase as needed based on the patient's needs. But a myth that it causes respiratory depression or that it will expedite death is not correct. And I just want to make sure that families and patients understand that that is the case. It is a really wonderful drug at the end of life to help people feel better. And it does, just like the lorazepam and the haloperidol, it is going to be taken orally. It is a liquid medication, and just as I said earlier, as patients are not able to always swallow at the end of life, it will just go in the side of the mouth, and you just put it in the cheek, and it will be absorbed by the mucosa in the mouth. And that is our EKit.